For 3 years, the Trump administration has altered long-standing policy towards asylum seekers and migrants along the southern border. Each new policy cut down the legal pathways people have for reaching the U.S. to declare asylum, but none quite put an end to the system that's been in place since the end of World War II. But on March 17th, the United States announced it would be turning back all asylum seekers along the southern border, regardless of their country of origin. Within a few hours, they would be returned to Mexico in an effort that the Department of Homeland Security said was to stop the spread of the coronavirus pandemic.
This is unprecedented in its blanket nature and its scope.
Hiroshi Matsumura is a law professor at UCLA who specializes in immigration law.
And I think this administration has tried mightily through much of its tenure to reduce the number of asylum applications, in effect, to make it harder to apply for asylum. And there are different ways it's done that. But the bottom line is that this coronavirus situation has given, I think, the administration an opening to essentially close the border to asylum cases in a way that it was, I think, trying to do, but doing it very imperfectly before.
DHS said it had authority to close the border to asylum seekers because of an order from the Center for Disease Control, allowing DHS to ban entry to the U.S. to anyone they believe will spread disease. This isn't the first time the U.S. has used illness as a justification for changing immigration policy. The Chinese Exclusion Act of 1882 was part of a racist backlash to a smallpox outbreak in San Francisco.
The use of public health reasons as pretexts or opportunities for more broad-based restriction, I think those kinds of developments run pretty deep in American history as far back as the beginning of federal immigration law.
But this recent closure of the border has yet to be challenged in court, and Matsumura believes that the Trump administration can't unilaterally close the border to asylum seekers based on CDC statute.
It's a quarantine statute. It's not a deportation statute. It's not a kind of immigration control statute.
Public health experts have expressed skepticism that the turnback policy stops the spread of coronavirus, especially as the pandemic hit the United States well before it spread to Mexico and Central America. Earlier this month, acting DHS Secretary Chad Wolf visited San Diego to commend agents that were carrying out the turnback policy.
So the CDC was very clear with us, with DHS and with CBP, as we needed to make sure we did not house those individuals in our facilities, both for our workforce protection, protection of our DHS officers, protection of the American people, and protection of other migrants. So we've been very successful at doing that over the past roughly 2 months.
Wolf said that 80% of migrants were returned to Mexico within 2 hours. The same day Wolf spoke in San Diego, the Trump administration announced that the turnback policy was now extended indefinitely, subject to 30-day reviews. At the same time, asylum seekers sent back to Mexico under the Remain in Mexico program have seen their court dates in the U.S. moved back well into 2021.
People are absolutely desperate on many levels. They're desperate for information because the court schedule keeps getting pushed back further and further, and they don't have a real way to understand what is happening or when their next court date has been moved to.
Nicole Ramos is an attorney with Al Otro Lado, a legal organization based in Tijuana that advocates for asylum seekers. Since the turnback policy, the organization has begun to focus more on humanitarian relief for asylum seekers stuck in Tijuana during the pandemic. They're raising money for prepaid debit cards to give to asylum seekers who need help. As the coronavirus pandemic continues to devastate both the economy and public health systems of both countries, barriers between the two continue to go up. Here in the Otay Mountain Wilderness, the first new border barrier in decades is being built in San Diego County. It will very possibly stay here for decades to come, much like many of the policies towards asylum seekers during the pandemic, built during sickness and maintained during health. Max Rivlin-Nadler, KPBS News.